comprehensive clinical documentation curriculum from Elsevier for ICD-10 and all your coding training needs. We all know the challenges ICD-10 will present. Unfortunately, just knowing isn't enough to ensure the level of specificity and quality of documentation that will be required to meet the demands of the new coding standard. That's where Elsevier e-learning comes in, with comprehensive coursework in clinical documentation designed for clinical documentation improvement specialists, coding staff, and physicians. With a long history in coding education, Elsevier has the tools you need for a successful transition to ICD-10 and beyond. Our extensive CDI education is accessible anywhere and at any time to help clinicians, coders, and CDI staff understand coding requirements and improve documentation in the most efficient and effective manner. Our clinical documentation curriculum for ICD-10 includes documentation basics for physicians, documentation standards and guidelines, documentation essentials for specific topics, diagnoses, and procedures. In overview, translating documentation into coding. Let's take a look at a sample lesson. As you will see, the goal of Elsevier e-learning is to provide relevant education in an easy, convenient, and engaging format, utilizing a variety of interactive activities, such as flashcards and exercises to test knowledge along the way. To simplify information, examples are provided with bullets for ease of learning. And all information is applicable to any type of record management system, paper, electronic, or hybrid. Designed for CDI and coding specialists, this particular coursework addresses the sections of the health record that will be integral to assignment of correct diagnostic and procedure codes. It also addresses problem areas, such as documenting severity of illnesses, identification of clinical indicators, assisting in interpretation of lab and X-ray findings, and medical necessity. Also included are scenarios of the types of documentation that would result in a physician query and what should be included in an effective query. The learner also will find many examples of documentation, the good, the bad, and the ambiguous. Among the wide variety of other topics addressed include documentation of acute versus chronic conditions under ICD-10, co-equal conditions and how that affects coding, principal diagnosis, DRGs, POA indicators, and hospital-acquired conditions that affect payments, as well as payment systems themselves, and much more. Yes, there's a lot to learn as the ICD-10 countdown continues, but we're here to help. Learn more today